Welcome back to ESPN West Palm tonight here on ESPN 106.3 and the free ESPN app. I am Cyrus Wittig, and right now I have the pleasure of being joined by Dr. Arun Hariharan, who is a pediatric, orthopedic, and spine surgeon with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center and Palm Beach Children's Hospital in West Palm Beach. Doctor, thank you so much for joining us.
Oh, always a pleasure. Thanks so much for having me.
Doctor, I did not know this, but Usain Bolt, the internationally known Olympic gold medal winning sprinter, who was once at the time the world's fastest man, was reportedly treated for scoliosis. First off, doctor, I think scoliosis is a term that most of us have heard, but I also think I speak for a lot of people when I say, what exactly is scoliosis?
Yeah, it's a very interesting tidbit that not many people know about. And believe it or not, and I have permission from the family to say this, but I took care of one of his second or third cousins. But scoliosis is a curvature of the spine. So most people have a pretty straight spine when you look at them from the front, but many people don't. And scoliosis specifically means a side-to-side curvature when you're looking at somebody from the front. But there's other types of scoliosis or scoliosis-related conditions where your spine can bend too far forward or too far backwards, and that's known as kyphosis when it's too far forward. But scoliosis is a side-to-side curvature.
Doctor, is there a general age range where scoliosis is more common? And how does this ailment develop over time for people who suffer with scoliosis at different points of their lives?
It really varies. There's all sorts of different types of scoliosis, but the most common one that we typically take care of in the healthy patient is idiopathic scoliosis, and that's what Usain Bolt and his cousin had. Usually this presents when children are undergoing a rapid phase of growth. So in girls, usually about 8 to 10, and boys 10 to 12-ish. And a very small proportion of the population actually has it. And most of them that do have it don't ever know it because it's such a mild form. But, eventually when they end up in my office or clinic, it's a little bit more severe. But it's usually in that rapid phase of growth, right before boys and girls hit puberty, that the scoliosis really takes off.
Again, Cyrus Wittig here on ESPN West Palm tonight, speaking with Dr. Hariharan of the Paley Orthopedic and Spine Institute at St. Mary's Medical Center. Doctor, is there a surgical and non-surgical approach for scoliosis treatment depending on the severity of the case? And could you tell us just a little bit more about the different cases that you've worked with in that regard?
Right. So it totally depends on the patient's age, the degree of curvature, and how much more growth they have remaining. And that's the biggest difference maker. Before we used to do screenings at school or with a pediatrician on yearly checkups, which is going to be the key determinant on whether or not they make it to my office. And usually if we catch them early enough, we can try all sorts of things like new bracing, which is based on 3D printed braces, or specific therapies that can help prevent the scoliosis from getting worse. And we base this all off of degrees. So if somebody's scoliosis measures over 25 degrees, then we typically put them in a brace. When that curvature gets over 45 degrees, then we have to talk about surgery.
Going back to Usain Bolt, he reportedly has a leg length discrepancy, which is exactly what it sounds like. One of his legs are reportedly bigger than the other. How common is leg length discrepancy, and how is that treated if it is severe enough to require treatment?
Leg length discrepancy is actually super common. Most people don't have equal lengths on both sides. And as long as it's about a centimeter or less, then most people don't even notice. Bolt's case, he probably noticed because he got x-rays for his scoliosis. And having a leg length discrepancy can actually make it look like you have scoliosis, or even make the scoliosis look a little worse than it is. So when you come to see us, we get a whole body picture with super low radiation that'll tell us about the scoliosis and about any leg length discrepancies.
Chatting with Dr. Hariharan, an expert in pediatric spine surgery. Doctor, why is it so important to be checked out by a center that specializes in scoliosis and things like leg length discrepancy, like the Paley Orthopedic and Spine Institute at St. Mary's Medical Center?
Yes, ours, out of anything, I'm going to say this is probably the most important part of it, especially in children. You can't just treat them as small adults. You really want to see somebody that's trained specifically to take care of somebody that's growing and maturing and changing, and all of these things make a huge impact that you go to somebody that's specialized in pediatric care and not just in overall orthopedic care. Because the growing child, even if it's a 16-year-old boy, is not the same as a 30-year-old man.
Doctor, outside of scoliosis, what other types of care do you specialize in?
So I'm a general pediatric orthopedic surgeon, so I take care of the entire gamut of orthopedic issues, including fractures, hips, knees, ankles, shoulders, you name it. And we have specialists in each of those locations of the body to help take care of you at the Paley Institute. But as far as general orthopedic care and fractures and sports injuries go, we can see it all and are happy to see you.
And doctor, what's the general age range of patients that you see?
I see patients from all ages, so usually 0 to 25 is where the pediatric cutoff goes, but there are specific pediatric conditions and skeletal dysplasias that really are pediatric conditions, but just because they're older doesn't mean we can't see them.
Doctor, as we all know, there is always so much research and new technologies, and we're always looking towards the future of medicine. When you think about what's next on the horizon, what really perks your eyebrows and says, hey, I'm really excited about this treatment or this strategy or this technique that could really help people down the road?
No doubt about it that things are constantly changing, but the most exciting thing probably in the last few years and going forward is what we call growth-friendly or motion-friendly surgeries. This kind of existed in the past, but none with the amount of success that we have now. And specifically, I'm talking about vertebral body tethering, where correct the scoliosis, but still allow the patient to grow and have some motion, which, the other ideas in the past weren't as good as this one probably. And we're excited to see what the long-term outcomes are, but things are looking promising.
Again, Cyrus Wittig here on ESPN West Palm tonight with Dr. Hariharan, who is a double fellowship-trained pediatric orthopedic surgeon with an expertise in pediatric spine surgery. Doctor, we've talked a lot about medicine and your work, but I know that you are also a massive Michigan Wolverines fan, so I can't let you go without talking some sports. First off, did you grow up in Michigan or perhaps near Ann Arbor, or did you spend any of your schooling there, or maybe both?
Yeah, I can't state enough how big of a Go Blue fan I am. So I grew up in Michigan, but I also went to undergrad, grad school, and med school at Michigan. And for 8 years, I missed only one Michigan football game season opener.
That is incredible, especially when you got to consider, or I have to consider, how much of your time was filled up by hitting the books to become, like I said, a double fellowship trained pediatric orthopedic surgeon. That's incredible. Of all those games, doctor, of all the times you sat in the big house, what's your favorite moment of a Michigan football game in Ann Arbor?
Hands down, the first night game against Notre Dame. We were down big, and Denard Robinson, shoelace, local Florida boy, brought us back to victory. We'll never forget it.
And who would you say is your favorite Michigan player of all time, even going back to growing up as a Wolverines fan in your childhood?
Shoelace Denard Robinson.
Okay.
I met him multiple times on campus. Nicest human being.
This year, 10-0, 7-0 in conference play. Of course, everybody paying attention and marking their calendars for the Ohio State game at the end of the year. But a tough one maybe for Michigan coming this weekend as they welcome the Illinois Fighting Illini into town. Illinois, losers of 2 straight, but they've been really tough all season and certainly looking to get back in the win column. Both these teams have excellent defenses. How do you see this one playing out here on Saturday?
I'm excited. Everybody talks about the big final game against Ohio State, but, you can't sleep on teams like Illinois. And the biggest question for Michigan all season has been the strength of schedule, but, we're looking good. The schedule is what it is, and
right.
I think on both sides of the ball, we're playing well. We need to up the passing game a little bit with JJ, but we'll get there.
Here on ESPN West Palm tonight, talking a little Michigan Wolverines sports with Dr. Arun Hariharan, who is a pediatric orthopedic and spine surgeon with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center and Palm Beach Children's Hospital in West Palm Beach. Doctor, before last year, Jim Harbaugh's seat was getting pretty warm. Where did you fall when it came to Jim Harbaugh's future at Michigan? Were you pretty skeptical that he could get the job done, or did you think that it was just a matter of time until he really got things rolling up in Ann Arbor?
You know, I was in med school when he was first hired, and I was very excited for the future, but my patience was growing thin, probably like the rest of the fickle Michigan fan base. But I never wanted him fired. I think he needed the restructuring, and it was hard to get rid of our defensive coordinators like Don Brown, but obviously it's working out well for him.
Want to talk a little Wolverines basketball now. Michigan had things rolling with John Beilein, took him to 2 Final Fours. Then you go to Juwan Howard after Beilein takes the Cleveland job. Things have been tumultuous, but ultimately pretty successful under Howard so far. What's the outlook for the 2022-2023 Michigan basketball team?
I think it's going to be good. Coach Beilein was great. He was also there when I was going through it and rebuilding the program, and he left a really good system in place for Juwan Howard. A little bit, rough last season, like you said, but I think we're going to be good. I'm excited.
Wrapping things up with Dr. Hariharan. Doctor, whether it's Michigan athletics or back to the medical field, is there anything you'd like to touch on or talk about before I got to let you go?
Yeah, we talked a lot about scoliosis and pediatric conditions, but listen, I think there's probably a bad rap out there for scoliosis. People think that just because you have scoliosis, your life changes, or because you have this diagnosis, you can't do things anymore. But we have all sorts of treatment options, and just because you have scoliosis doesn't mean you need to be stuck in a brace or have surgery that makes you stiff as a board. I have patients that go back to tackle football, go back to gymnastics and cheerleading, and it's not the same as it was 20 years ago or like it is in the movies. So happy to chat with anybody and do your research online. We're here for you.
Before I let you go, Doctor, if you wouldn't mind, could you just share the information for the Paley Institute where our listeners and potential patients can find more information about the Institute and more specifically, more contact information about you and your colleagues?
Yeah, absolutely. The easiest way would be to either Google or just type in paleyinstitute.org, Paley institute.org. Our phone number is 561-844-5255. If you go on their website, you can read all about our doctors. You can read all about our spinal care. You can go onto my profile or any of my teammates' profiles and easily get in touch with us. Our emails are all over the place, so send us an email anytime. We'll get back to you.
Dr. Hariharan, thank you so much for joining us here on ESPN West Palm tonight. Really appreciate your time. I look forward to talking with you again soon, but in the meantime, go Blue.
Go Blue. Happy to be part of this community.
Again, that was Dr. Hariharan from the Paley Orthopedic and Spine Institute at St. Mary's Medical Center and Palm Beach Children's Hospital. We'll have more on the other side. This is ESPN West Palm Tonight.